Liposuction complications which I have had to fix from other surgeons. Liposuction is the most commonly performed cosmetic surgery procedure worldwide, and when done with the proper planning, proper equipments by a skilled cosmetic surgeon, this is one of the safest procedures. But again, sometimes there are chances of complications which again needs to be managed by an experienced surgeon. After so many years of my practice and seeing so many patients of liposuction for whom I have done liposuction or they have come after liposuction from some another clinic, I have seen some complications which I needed to fix. The most common complication or revision case is lumpiness or contour irregularities. Why it happens? It happens because of poor technique, because of aggressive liposuction, because of uneven fat removal, and because of improper post-operative instructions and patient not wearing the compression garment. How it presents? Visible dents, asymmetry when patient stands, nodules or fibrosis, and contour irregularities. And how do I fix them? Sometimes they need fat grafting, sometimes we require energy-based devices to break the adhesions, sometimes we add on limited liposuction to revise that area, or sometimes subcision helps. Another complication which I usually revise is overcorrection or too much removal of the fat. This issue is again very difficult to correct. This is very difficult to correct and needs immense amount of expertise and skill to correct these irregularities and these deformities. Why it happens? It happens because improper judgment of the superficial fat layer, high volume removal without proper planning, or chasing the extreme thinness in the skin. What I see in these patients is skeletonized look, skin adherent to the muscles, and visible grooves. Correction is definitely complex in these patients, which might require structural fat grafting, sometimes may require dermal fat grafting, and sometimes even these irregularities are not even correctable. And the third most common complication which I observe in my clinical practice is seroma formation or fluid collection. Is very common after aggressive liposuction or with high volume liposuctions. Common causes are excessive trauma because of excessive liposuction, inadequate activity by the patient, and patient non-compliant and not wearing pressure garment as advised by the treating surgeon. And how do we manage these patients? Serial aspiration is required, then proper compression garment is given, and along with it, sometimes a drain might need to be placed to drain the fluid so that patient gets a natural contour. Another complication which although is rare but is very dreaded is skin necrosis after liposuction. And what is the cause of this skin necrosis with inexperienced hands? Aggressive liposuction, which again is too superficial, and along with it any other reason which compromises the vascularity of the abdominal wall again adds to this complication. And how do I treat these complications? It requires proper wound management, debridement, serial excisions, and sometimes suturing as well. Another complication which I correct is asymmetry and poor aesthetic results. This often is not a technical problem but usually happens after improper planning of the case, like abdomen done without plan, or ignoring pre-existing asymmetries, or doing thigh liposuction without banana roll dressings. These cases require a proper artistic eye at the end of the cosmetic surgeon, proper pre-operative discussion and counseling of the patient, and sometimes combining the various procedures to get the best desired outcome. So in my practice, the pattern which I have noticed in these patients, I usually see one of these three issues. One, it can be because of improper or poor planning at the end of the cosmetic surgeon. Then again, another important factor is poor patient selection by the cosmetic surgeon, and also attempting to compete for a lower price rather than focusing on the quality and the best outcome for the patient. Fixing a bad liposuction surgery is 3 to 5 times harder than getting the primary liposuction done properly. And the most important point which you need to understand is that some deformities, some complications are not even correctable. So you need to be very careful while choosing a liposuction surgeon. For your liposuction surgery, surgeon should be skilled, surgeon should be experienced, surgeon should be qualified enough to do a liposuction surgery. So check the credentials of your liposuction, the experience, the cases he has done, then decide upon before choosing a proper clinic for your liposuction. Follow us for more such informative videos and subscribe to our channel. Thank you.